You watching? You sure? Here's how you can reverse your diabetes and high blood pressure in no time using a doctor in the sky.
Hey guys, my name's Michelle, Anita,
Sarah, Leah,
Peyton, Talia,
Jazz,
Marquita.
I'm a physique.
Product. Period. You love to see.
You already know what this is. It is Trehunna from Secret Set, and today what we're going to talk about is the importance of you getting some sunlight within your day. If you are somebody who is a minority, one thing that you probably noticed if you paid attention, we're getting a lot more pre-diabetes per generation, a lot more hypertension per generation. And we already know that cardiovascular disease is at an all-time high. But the question is, what is the main cause of this? We are not receiving enough vitamin D or cholecalciferol. Vitamin D is not just a vitamin. It is a hormone that every cell in our body needs. From your heart cell to your kidney cells actually has a vitamin D receptor. And vitamin D overall is anti-inflammatory for the human body. If you are melanated, we got a tint to us, right? Which means we got melanin. Now, ironically, because we have melanin, we have to spend a little bit more time outside than everybody else. So if we're not getting as much sun rays, and keep in mind, a lot of us works now remotely, we're not getting any vitamin D unless we're in a car and we're riding around in our car. That's the only time we get vitamin D. Going from our car to our house, from our house to our car. We're not spending no time outside. Because that is the case, and because vitamin D is anti-inflammatory, we are more prone to inflammation. That means you're more susceptible to lupus or Hashimoto's, autoimmunity, or just any type of flare-ups, eczema, allergy symptoms, psoriasis, things like that because of lack of vitamin D. So Trey, that's cute and all, but how does vitamin D correlate with diabetes and high blood pressure? When you are actually receiving some vitamin D, we got cholesterol underneath our skin called 7-dihydrocholesterol. Once we receive some vitamin D, it hits our skin, then it's gonna convert this to 25-hydro vitamin D. But not only are we receiving vitamin D from the sun, it's what this sun rays is making our body do. Believe it or not, there's studies that show that somebody who smokes and receives some vitamin D actually lives just as long as somebody who don't smoke at all, don't get adequate amount of vitamin D. And how much is inadequate amount of vitamin D? That is 30 nanograms per milliliter. And if we all had our blood panel test at one point in time, you probably see that a vitamin D number was kind of low, right? So if it's underneath that, you're not getting an adequate amount of vitamin D, not just from the sun, but probably from your diet as well. But if smokers who get vitamin D live just as long as somebody who don't get vitamin D but don't smoke at all, that just shows you how important it is us getting some sun rays or UVA and UVB rays. When your body is receiving UVA rays, what your body is going to do is going to start producing more nitric oxide. This is the thing that actually vasodilates or relaxes your arteries. Which means what? If you have pre-hypertension or high blood pressure, your arteries are rigid. It is stiff. But if you have something that dilates it, which means it's opening up, blood can roam freely throughout your blood vessels and your arteries and capillaries. If you are somebody who is pre-hypertensive and got diabetes, 9 times out of 10, you're probably somebody who doesn't spend a lot of time outside. Because what the nitric oxide also does, it makes your body a little bit more insulin sensitive. When you are insulin resistant, you're eating these carbs. Your body's receiving glucose, but your body's not receiving the signal to dispose these carbs out of the bloodstream. That's what causes oxidation. That's what actually corroding and rusting your arteries and your blood vessels. But now, if you're insulin sensitive, now your muscles getting the signal that,
hey, we need you to soak up this glucose.
Now your fat cells is getting the signal that,
hey, we need to soak up this glucose.
And now because your cardiovascular system don't have a lot of glucose in the system, now things are not getting glycated, and that means basically it's making your cells more dysfunctional. You need to be insulin sensitive for your body to not have diabetes. Now your arteries also got to be flexible for you to not have high blood pressure. You can get these two things for free, 99, if you spend some time in the sun.
Now Trey, well I heard that if I spend too much time in the sun, I'm gonna get skin cancer. What should I do?
Yes, if you spend way too long in the sun, you're gonna get skin cancer. But what is way too long in the sun? You're out there for 45 hours. Okay, so as a recommendation, if you're somebody who is Caucasian or you're from European descent, what I'd love for you to do is get at least 30 minutes out in the sun. If you go outside from 8 a.m. to 11 a.m. and you also go outside from anywhere past 4 p.m. till 7 p.m., your body is not going to get sunburned as much. Why? There's not a lot of UVB radiation present. So when the sun is at the highest in the sky, that's when everything is a little bit more dangerous. And think about it. The sun is at its highest point around 11 o'clock to 2 p.m. The best time for you to go for a walk or not to get sunburnt, you should actually spend more time walking outside from 8 o'clock to 11 a.m., 4 p.m. to 7 p.m. During these times of the day, your body's receiving a lot more UVA radiation. That's the type of radiation that allows your body to produce more nitric oxide. And that's the thing that's going to help you lower your glucose levels along with dilating your blood vessels. Once you start getting to 11 a.m., you're receiving a lot more UVB radiation. Now, UVB radiation is the one that people are more likely to get sunburnt from. And this is the type of radiation that could cause more melanomas. On the flip side of it, that's the time where you're also receiving a lot more vitamin D from the sun. But once again, you can get best of both worlds is when you go out a little bit earlier during the day and later during the day.
Okay, Trey. Well, I want to spend more time in the sun, but for some odd reason, every single time I step foot in the sun, I get sunburned no matter what I do.
What should I do? What I would tell you to do is you need to start focusing on getting in more omega-3s. Your body's skin is made out of protein, so glycine, hydroxyproline, and proline, right? But underneath the skin, it's fat. If you eat a rich diet in omega-6s, such as you're eating a lot of chips, you're eating a lot of processed foods, you're eating a lot of vegetable or seed oils. And by the way, vegetable oil is not coming from vegetables, it's coming from seeds. And by the way, these seed oils back in the day used to be used as machine lubricants. By the way, they just found a way to bleach it and sell to you. But anyways, if you're having a lot of seed oils in your diet, which are pro-inflammatory, now your cells is composed of a lot of omega-6s. So once the sun is hitting it, it will break down to arachidonic acid, and long story short, it's going to turn to series 2 prostaglandins. So these are the ones that could cause you to be more susceptible to melanoma and for you to get sunburnt just in general. If you're getting more omega-6s, it'll be easier for you to get sunburnt. Now, omega-6 is not bad, it's just the ratio that we eat, because a lot of people don't eat a lot of seafood anymore. It's way off. So we're now always in a pro-inflammatory state. What I'll tell you to do is start incorporating more fish oil or boom, Carson's cod liver oil, especially if you're somebody who does not eat a lot of seafood. Omega-3s is one of the most important fats in your body. Why? Because it's anti-inflammatory. If you're taking this Carson's cod fish liver oil every single day, and don't take a teaspoon, take 1 tablespoon. That way you can get about 2 grams of EPA and 1 gram of DHA. You should be good, especially if you're taking that daily. And now you're going to realize that when you're out and about, you're going to be less likely, long story short, for you to get sunburned. All because you changed the omega-3 to omega-6 ratio in your body, which means also in your skin. Keep in mind, you are what you eat. We heard that all our life. We just didn't know what that meant. So when we're giving our body these proteins, or for some people, a lot of processed foods, then you are going to be more inflammatory. So that's why you need to have more of an anti-inflammatory diet, which means what? Start eating a little bit more whole foods, foods that your grandma will recognize. I'm pretty sure your grandma wouldn't know what a Rice Krispie treat is. Safe to say. All right. So other than that, make sure you get some vitamin D. If you're a little bit more melanated, you want to spend at least an hour a day on average outside. You don't gotta do a straight hour. You can do 20 minutes earlier during the day, 20 minutes midday, 20 minutes later during the day. Or, like me, you can do 30 minutes during the day and 30 minutes around 6 o'clock, 7 o'clock. Just make sure you get some vitamin D in, watch your HbA1c drop, and also you're gonna realize that, hey, I don't even gotta take my blood pressure medication anymore. All because I decided to get more sunlight from the doctor in the sky. That's gonna be your reset tip of the day. It's gonna be Stay Snatch all the time. Notice sometime. Go ahead and get that sun rays, lady, before winter comes. Cool. Talk to you soon.